I witnessed, recorded, and produced these videotapes of the Washington, D.C. hearing. Their authenticity is above question.
This is produced as part of the ongoing work on the website, thewaythetruthandthelife.net.
This is a hearing about the government licensing the electrocution of people to cause grand mal seizures. Think of the millions of dollars, taxpayers' money, spent to pay psychiatrists and their supporters and for the worldwide travel in putting this conference together, while the victims and opponents had to pay their own way.
What is the cost of this therapy compared with comparable drug therapy for a similar course? And also, are the professional fees charged about the same?
There are variations in the cost of ECT. The cost of treatment may run on an average of $75 to $150. The cost of an anesthesiologist about $60 to $120. There are varying institutions charged differently for the anesthesiologist or has to this time. And it's difficult because ECT can be very effective. People can be very sick for many months, or even a year or 2 years, have 3 or 4 ECTs, and leave the hospital within a couple of weeks. That can be very dramatic. That's one of the clinical experiences that many people have had, and the research data bears out that clinical impression. So one has to compare those costs with the cost of hospitalization in seriously ill patients, along with the cost of medications.
One electroshock treatment can equal the energy of 3 pistol shots to the head.
Dr. Rose accepted 2 pieces of literature for reference. I would hope you might make copies available for the panel. We're talking about having a police factor information on the device and what we're using. And one copy is the Thymoton, the brochure on a single sheet handout on the Thymoton pulse ECT device, and in there it shows the physical characteristics. I also included a current Winchester ammunition catalog because it shows the energy with which the bullets have. But running this machine at its maximum brings 201 joules of energy. That is 148 foot-pounds. If you're interested in actually understanding, like the truth in lending, what they're talking about, 1 joule is 0.07376 foot-pounds. But what this means is this device, when operated at its maximum capacity, will lift a 1 pound weight 148.7 feet. The energy contained in that is equivalent to 3 25 caliber pistol slugs. Now that is just pure factual data. To give that lifting of 1 pound energy equivalence in informed consent, how could you not do that? And if you're going to give a procedure, the total energy and the total time are the physical parameters that characterize the device. How could you not include that information? And if a doctor prescribes a drug, he has to record the prescription. Why isn't the total time and the total energy recorded? This has been an experimental hazardous device for years now. Why hasn't this information been gathered that we could be talking with concrete, objective facts rather than the subjective opinions of psychiatrists and patients?
One electroshock treatment can equal the energy of 3 pistol shots to the head.
All right, out with your gun.
Huh?
Out with your gun.
Okay, this won't hurt. It'll be over in just a moment. Uh-huh. What's that?
Conductant.
Oh, dab will do you. Right, Mr. Jackson.
Open your mouth.
What's that?
This will keep you from biting your tongue.
Well.
Now just bite down on it.
Oh.
That's right. Just bite down.
Huh?
Now bite down on it.
Good. Are you ready? Here we go.
Yes.